We're joined at the University of Toledo Medical Center tonight by Dr. Shuab Omer, a cardiothoracic surgeon here at the hospital. And there's some new procedures, new techniques coming down the line when it comes to heart failure, doctor, and something you're not using yet, but you're in the stages of making it happen. Give us an idea of some of those procedures.
Yeah, for end-stage heart failure, classically people used to get a heart transplant. But the problem with heart transplants is that the number of donors in the U.S. has stayed steady, but the number of recipients for heart transplants is ever increasing, and most of them have end-stage heart failure. And for them, luckily, a lot of research has been done in the areas of heart assist devices. These are not like artificial hearts, but more like left ventricular assist devices. And recently, FDA has approved them for destination therapy. Okay. That means you can put these devices in a patient with surgery, and they can give them a number of years, though they stay tethered to, to a battery pack, but they can be pretty functional. And it does not necessarily mean that they would need a transplant after that. It means it's destination for them, and they can live a nice quality life for the remaining years of their life with that.
Do you have kind of a time frame of how long that would last?
This has just started, and there are patients who have lived for years, 5 years, 4 years, 3 years, 6 years at times, and there's a lot of research being done on these devices. They're getting smaller, easier to place, and more reliable. And we hope to start this at the University of Toledo pretty soon.
And I guess in an ideal world, the heart transplant would be the best thing to do.
Yes. But the way these devices are being developed, it's quite conceivable that in the future that they might give you as many years of freedom from any problem as heart transplant does, but that's something for the future.
Okay, so there's some positive news. I mean, even though the transplant numbers are kind of staying where they are, you guys are taking a more aggressive approach because you probably don't see the numbers spiking anytime soon.
Right. Absolutely. Okay. Absolutely.
Time frame, do you know when we could start seeing patients locally maybe start getting these?
In a few months.
In a few months?
Yeah.
Okay. All right, so exciting news there. Dr. Shuab Omer, we appreciate your time here at the University of Toledo Medical Center, and that is your Talk Back.